here. Okay. As a way to organize this information, make sure you're working on that table in the background, somewhere in your notes where you're comparing important features of arteries, important features of arterioles, and as we get into capillaries, important features here, but also some of the laws that govern how that exchange of fluid takes place across the capillary wall. So a little bit more detail in terms of what's happening at the capillary beds. And so we left off on Friday. We basically were describing some features of capillaries. We talked about the 3 different types of capillaries. And then we really zoned in on the continuous capillaries. We said that they were the most prevalent, the most common. They had the smallest window or pore in between those endothelial cells. And so they did not allow some of the larger molecules, larger cells, and erythrocytes and so on to go through those pores. And so as we pick up here, and speak about the regulation of flow through capillary beds, and later on, the Starling forces that govern the movement of fluid across capillaries, I really want you to keep your focus on that first branch of the, not branch, but that first subtype of capillaries, which are the continuous capillaries. Okay. Now, as far as regulating flow or controlling flow through capillary beds, there are 3 structures that help with this. There are arterioles. We've talked at length about arterioles and how they can regulate their flow by either constricting that inner smooth muscle layer to allow for decreased flow, more resistance, or they can relax that smooth muscle and allow for decreased resistance or increased flow. And so we're not going to talk any more about arterioles, but we want to just bear that basic relationship in mind, that resistance in these arterioles is related to the amount of flow coming through the arterioles, and that is regulated by the smooth muscle that is inside the arterioles. The other 2 mechanisms of regulating flow through capillary beds are meta-arterioles and then precapillary sphincters, which are really just strategically located bands or strips of smooth muscle that help to determine whether or not flow goes into the capillary bed or it bypasses in the case of the meta-arteriole. So we'll talk about that a little bit more here. So essentially, meta-arterioles are this intermediate branch of vessel that connect arterioles on one end and the venules on the other end. So they're basically this intermediate in between arterioles and capillaries. And so the flow here is going from the arteriole, as we can see here on the left, bypassing the capillary bed. So here are the capillary beds above and below, and in the center is this meta-arteriole, okay? And it's basically got these strategically located rings or bands of smooth muscle that will either relax or contract in response to the state of the local tissues. And so it essentially is going to shunt or bypass blood from going to the capillaries and send that blood directly back to the venules, okay? And, you know, it's kind of counterintuitive to think that we're going to be bypassing the capillaries, but in some instances that is ideal. That is what we want. If we want to speed up flow, or if the tissues are well oxygenated, as we've pointed out earlier, so really the state of the local tissues, if there are metabolites building up versus not, we can determine whether or not flow goes to the capillary bed or whether or not it goes into the meta-arteriole, bypasses the capillary bed and goes right over to the venule end. Okay, so it essentially is going to shunt or bypass the capillary bed altogether. As far as the precapillary sphincters, these are other strips of smooth muscle in other locations. So here we're not seeing this whole vessel or the smooth muscle located here. These are just bands that are at the beginning of the capillary bed. So we can see examples here, the precapillary sphincters, and sphincter just means strip of smooth muscle. And so when these sphincters contract or relax, again, in response to some of the local factors, depending on the state of the tissues in this region, they're going to contract, to constrict or squeeze down. And as you can see or imply by their location, if I were to constrict or squeeze down on this band of smooth muscle, blood is not going to go into the capillary bed. Instead, it's going to be shunted into the meta-arteriole where it bypasses the capillary bed and goes to the venule. On the alternative end, if I relax this precapillary sphincter, I am going to increase flow into the capillary bed, as you would imagine, because of this location. So that is going to allow blood to not go through the meta-arteriole and directly to the venule, but instead go into the capillary bed where we want it and allow for diffusion of oxygen and other metabolites into and out of that capillary bed at the local tissue level. Okay, so this is also influenced by the state of the local tissues, whether they need more flow to eliminate excess metabolites that are building up. And just to clarify here, when we talk about metabolites, I'm referring to those local factors that we talked about back in arterioles. So things like acid buildup, potassium buildup, CO2 buildup. And so when those metabolites build up, we mentioned earlier, that is an indicator that this tissue needs more flow. And so what happens is we're going to relax the precapillary sphincter, allow for more flow into the capillary bed instead of bypassing. And that will allow an opportunity for flow to come in and clear those metabolites, as well as bring in fresh oxygen into the tissues. Okay. And so let's kind of put all of that together in a table format here and clarify how that flow is actually regulated by each of these variables. So we're looking at factors that affect capillary flow. And actually, let's say this in another way, factors that affect flow to capillary beds. Just so that it's clear, we're talking about the flow that's going either to capillaries or bypassing those capillary beds. And so let's look at this on the basis of 3 parameters here. We've got smooth muscle distribution, so basically describing what that structure is. The second is going to be the direction of flow, pretty much where that structure is facilitating flow towards. So direction of flow. And then finally, regulation of flow to capillary beds. And this is essentially if we contract or relax, what happens to the flow accordingly. So first off, let's identify the 3 structures in question here. So we've got the arterioles, which we have already spoken about previously. We've got the meta-arterioles, that intermediary connection there. And then we've got these precapillary sphincters. Okay. So just to describe these, basically, we know that the arterioles have a uniform ring of smooth muscle. So it lines the entire inner surface, not the lumen, because that's where we have the endothelial cells, but rather that middle layer of the vessel, that smooth muscle layer. It's a uniform ring of smooth muscle. The meta-arterioles and precapillary sphincters are really strategically located bands or strips of smooth muscle. So they're not uniform throughout the entire structure, but strategically located bands or strips of smooth muscle. And same is true for the precapillary sphincters. Okay, let's talk about how they direct flow. So we know that arterioles are going to capillary beds. Pretty straightforward. They direct flow to capillary beds. We know that meta-arterioles are bypassing capillary beds, so really towards venules. So bypassing rather, capillary beds. In other words, towards venules. Okay. And then we also know that precapillary sphincters are also at the beginning or towards capillary beds also. So this is also going to capillary beds. Okay. As far as the third feature here, which is regulation of flow and how each of these structures can regulate flow to the capillary beds, let's look at what happens when these structures contract versus when they relax. Okay, I'm gonna kind of lean on your guidance here just to help me fill these in. Oops, contract and relax. And then we'll put contract here and relax. Okay, so what happens when each of these either contract or relax based upon what we said so far? So let's start with arterioles. So what happens to flow to capillaries when arterioles contract? Can anyone remember or kind of just make the connection here from arterioles? So if I contract my arteriole, will my flow increase or decrease to capillary beds? Okay, great, excellent. So I'm seeing decrease, which is perfectly correct. So as I contract my arterioles, my flow to capillary beds will decrease, right? And think about resistance here as well. Though I'm not going to write that out. You can probably put in your own notes what the resistance would look like in order to allow for that increase or decrease flow. So as resistance would increase, then flow would decrease, okay? What about if I relax those arterioles? And we're thinking about this uniform ring of smooth muscle being relaxed, right? Not the entire, well, the arterial lumen itself, but more specifically, the ring of smooth muscle. When that relaxes, flow would increase or decrease. Excellent, increase. Okay, so we're going to be the opposite. And as the resistance decreases, the flow would increase. Let's look at the meta-arterioles. So as this band or strip of smooth muscle, the meta-arteriole, contracts, would my flow to capillary beds increase or decrease? And we want to think about what the meta-arteriole is doing. It's bypassing or shunting towards venules. So as I contract, does flow to capillaries increase or decrease?
Increase.
I'm seeing decrease, but that's not correct, and I want us to understand why. Remember, the meta-arteriole is moving blood, right? If it were open and patent, it would be moving or shunting blood from the arterial end all the way to the venule end, so bypassing that capillary bed. And so if I contract it, I'm going to oppose that movement. I'm going to oppose that flow, that bypassing or shunting. And so flow to my capillary, remember, we're talking about what's happening in terms of movement towards the capillary bed, that would be increasing. Okay, and I'm seeing that here in the chat as well. So as I contract my meta-arteriole, I decrease resistance in the capillaries and I increase my flow to the capillary beds. Okay, really important to understand why this is different from arterioles. On the alternative end, if I relax those meta-arterioles, remember these again are shunting towards venules, I'm going to be driving more blood or shunting more blood towards my venule end. And so I would be decreasing the flow that's going to the capillary bed. Okay. In other words, increasing the resistance to the capillary bed here. And then the final area here, which is the precapillary sphincter. So if I contract my precapillary sphincter, and if you remember that strategic location, it's right at the base or the beginning of the capillary bed. And so if I contract it, what do we think will happen in terms of flow to that capillary bed? Excellent. So I'm seeing coming up in the chat here a lot of response for decreased blood flow or decreased flow, and that is perfectly correct. So as I contract that precapillary sphincter, I'm really aiding that blood. Instead of going into the capillary bed, it's going to go into the meta-arterial, and that's going to be decreasing flow to my capillary bed. On the alternative end, if I relax that precapillary sphincter, I'm facilitating that blood to move into the capillary beds, and that would be obviously increasing flow. Okay. So just to make a little bit more sense of these three different areas that regulate flow to capillary beds, and how the direction of flow is slightly different, especially with the meta-arterial. So they're not necessarily moving towards the capillary bed themselves, but they do influence flow to the capillary bed because they're bypassing or shunting away from that bed and towards the venules. Okay, so make sure you're making the connections in terms of increasing or decreasing, contracting or relaxing the way that we've done at the bottom here.